How is Crohn's disease diagnosed? Your healthcare provider may use many tools to make a diagnosis. A medical history, which includes asking about your symptoms, a family history, a physical exam, including checking for bloating in your abdomen, listening to sounds within your abdomen using a stethoscope, tapping on your abdomen to check for tenderness and pain and to see if your liver or spleen is abnormal or enlarged. Various tests, including blood and stool tests, a colonoscopy, an upper GI endoscopy, a procedure in which your provider uses a scope to look inside your mouth, esophagus, stomach, and small intestine. Diagnostic imaging tests such as a CT scan or an upper GI series. An upper GI series uses a special liquid called barium and X-rays. Drinking the barium will make your upper GI tract more visible on an X-ray. What are the treatments for Crohn's disease? There is no cure for Crohn's disease, but treatments can decrease inflammation in your intestines, relieve symptoms, and prevent complications. Treatments include medicines, bowel rest, and surgery. No single treatment works for everyone. You and your provider can work together to figure out which treatment is best for you. Medicines for Crohn's include various medicines that decrease the inflammation. Many of these medicines do this by reducing the activity of your immune system. Certain medicines can also help with symptoms or complications, such as non-steroidal, anti-inflammatory drugs and anti-diarrheal medicines. If your Crohn's causes an infection, you may need antibiotics. Bowel rest involves drinking only certain liquids or not eating or drinking anything. This allows your intestines to rest. You may need to do this if your Crohn's disease symptoms are severe. You get your nutrients through drinking a liquid, a feeding tube, or an intravenous IV tube. You may need to do bowel rest in the hospital, or you may be able to do it at home. It will last for a few days or up to several weeks. Surgery can treat complications and reduce symptoms when other treatments are not helping enough. The surgery will involve removing a damaged part of your digestive tract to treat fistulas, bleeding that is life-threatening, intestinal obstructions, side effects from medicines when they threaten your health, and symptoms when medicines do not improve your condition. Changing your diet can help reduce symptoms. Your provider may recommend that you make changes to your diet, such as avoiding carbonated drinks, avoiding popcorn, vegetable skins, nuts, and other high-fiber foods, drinking more liquids, eating smaller meals more often, keeping a food diary to help identify foods that cause problems. In some cases, your provider may ask you to go on a special diet, such as a diet that is high-calorie, lactose-free, low-fat, low-fiber, or low-salt. If you are not absorbing enough nutrients, you may need to take nutritional supplements and vitamins.